Moving on to our next feature, I think this is going to be a really fun and more interactive session in terms of teleadvocacy. I would like to introduce Dr. Valentine and Dr. Kithcart. Dr. Valentine is a member of the Cardiovascular Division in the University of Virginia and also an ACC past president. And Dr. Kithcart is an Associate Medical Director at Regeneron Pharmaceuticals and ACC Health Affairs Committee member. And I'd like to introduce them for their teleadvocacy advice and role play.
Good afternoon and welcome, and thank you for having us. We are honored to be doing this again, and Aaron and I have had the pleasure of doing this in the past and look forward to it. Aaron?
Yeah, welcome everyone, and happy to be here, and thanks for giving some of your time this Saturday to join us. And so I think to get started, what we want to do is go through a couple of different scenarios. To be completely fair, I've been going to Capitol Hill for maybe 10 years since I was a medical student. And this is the first time I've ever done teleadvocacy. So I think for a lot of us, this is going to be a very new experience. But I think as many of us have learned over the last 6 months, we're becoming experts at Zoom meetings and WebEx. And so what Mike and I would like to do is go through a couple different scenarios. The first is going to be some common mistakes that can be made during your teleadvocacy meetings. And so to start off, I'm going to be an early career physician in the American College of Cardiology, and Dr. Valentine is going to be our senator, who is joining us from his district.
So
should we get started?
Let's get started. Let's get started, Doctor.
So before we do that, Senator, I just wanted to let everyone know this is meant to be interactive. It's a little harder to do this when we're not in person, but please give us comments in the chat, or those of the panelists feel free to make comments as well. So Senator, thank you for being here today. It's great to meet you. I'm Aaron Kithcart. I'm a cardiologist in New York, and I'm representing the ACC, and was hoping to talk to you about advocacy and maybe some of the things that are really important for us here.
Yes, I'm ready to speak. You've got some feedback there.
Yeah, sorry, my dogs are barking. Hang on, let me see if I'm sorry about that, Senator. All right, they're gone now. But I wanted to talk to you about a few things. So, first of all, I want to really thank you for your support of the Bipartisan Budget Act in 2018. That actually allowed us to expand access to cardiac rehab for our nurse practitioners and PAs. So thank you very much for your support on that. Well,
young doctor, you may have me mistaken. I know that you're here in New York, and I assume that you're a member in my district, but I had some concerns about that bill and actually voted against this because of the financial implications, and which, as you look now with COVID-19 and the amount of debt we have, has turned out to be an absolute disaster. So I have to tell you, I was not a big fan. Not that I don't support you doctors. I really do support you doctors. But if you had looked at the CBO, you know what the CBO is, don't you?
Can you tell me what that means again?
Okay. Well, the Congressional Budget Office really does rankings and sets out the amount of money required for each of these projects. And if you look at some of the projects that you have advocated in that, they were incredibly expensive. And now that we are in a massive budget deficit and looking at even more deficit with COVID-19, I think you have to be very careful in what we support. And it's not that I don't support our physicians, our nurses, and our caregivers, but right now does not appear to be the time to be pushing out a lot more cash when there's so many others that need it more.
I'm really sorry, Senator. I didn't realize. So maybe then I could ask you to co-sponsor the Protecting Access to Post-COVID Telehealth Services. It's HR 7663. So I was hoping, Senator, you could co-sponsor that House bill.
Well, remember that this is a House bill, young doctor. There is no companion in the Senate at this time. Certainly, we are supportive of our practices that are struggling. I know that, again, everybody's struggling right now. It's a COVID world. It's not a post-COVID world yet. But if you can, if you're able to get a Senate version of this, then I will be happy to look at it. As you know, I am a senator. You quoted a House bill there. There's no companion at this time. So let's make sure we're on the same page here. I really do want to help you guys, but we need to be on the same page and what we're supporting, what the bills are, what is in the House, what's in the Senate, what we can do.
Maybe that's something that you would be willing to write then for the Senate?
Well, you know, I would be happy to look at it. I know you're with the group of cardiologists. You know, many different groups of doctors come in my office, or this way, they're actually calling me on a daily basis, and my staff deals with them. So has the cardiologists, has the ACC, or the American College, have you been supportive of us? I know that you're very active. You seem to be quite active on TV. So have you been supportive of my campaign and what I stand for?
I don't know about that, Senator. What you mean support? Did I vote for you?
No, I'm not asking if you vote. You do understand that your PAC and your group supports candidates who are favorable to medicine, or at least they should be. Maybe you need to go back and look. Are there some more senior members that might understand that, might be able to help you with this a little bit?
Yeah, maybe I'll talk to some other people from my state. Well, Senator, I want to be respectful of your time. I was hoping, you know, there was one more issue that I wanted to bring up. You know, I live in New York, and it's really expensive to park my car. You know, parking garages are really expensive, and maybe we could have some relief with COVID-19 and reduce parking rates in New York. What do you think about that?
You know, there are incredible needs all across the board right now. I understand your needs there. I would say, why don't you address some of the smaller, more local issues, perhaps with my staff? Have you talked to any of my staff members yet? Do you know my Health LA here? Do you know my local representative? I know where you're in training in New York. Have you been to my office locally?
I don't know about your office. I'm at NYU. Is that close to where your office is?
Actually, it's 3 blocks from my office. Oh. So if parking is an issue, I would suggest perhaps you walk to my office. My representatives are there. If you wear a mask and come in and social distance, they can address your needs. We actually have an outdoor area where you can meet with my staff and do this in a safe manner. And I would suggest very strongly that you get in and meet with my staff and contact us. There's a lot you can do, Doc, and we're really looking for people like you who can dig in and know their stuff.
Well, thank you, Senator. I think this went really great, and I appreciate you signing on to the HR Bill 7663 and all of your support for cardiology. Thank you.
Oh, thank you.
All right. So maybe we can get some comments from our panel, our participants. What could I have done better in that interaction? People are laughing.
Dr. Lewis, Aaron, tell us if you kept a list of what Aaron should perhaps not have done and what he could have done better before walking in and in his televisit. What would you say? Sandy, you take one. Aaron, Brenton, each of you take one area perhaps and
Lock
say,
up the dogs.
Say that again, Sandy.
Lock up the dogs. Be prepared. Have your situation to be visible, clean, and ready for you to interact.
Yeah, I would say that's a great comment, and in particular, it was really funny. I laughed out loud when you followed that you didn't want to waste the senator's time by completely wasting his time with the parking lot issues. So I think, you know, choosing your conversation wisely of what your asks are, like referring back to what Dr. Chen and others have mentioned about your specific asks, and making sure these asks are something that is worthwhile and is for our patients, and what the Heart Pack, the ACC are pushing for, and not, you know, necessarily personal, meaningless kind of things that are truly wasting time, I think would be very useful.
That was a phenomenal conversation. I felt that. I was cringing in my video, but I think an important piece of that is knowing your audience as well, just like you were saying about not wasting someone's time, but know who you're talking to. And that's a multifaceted comment, because didn't recognize that there was no companion legislation for the legislation that you brought forward. You didn't recognize you were talking to a senator. That was definitely. And you didn't also the legislation that you brought up that the senator you were talking to actually opposed. That was, I felt that.
Yeah, so there were a number of issues there, obviously, that I focused on. But, you know, first and foremost is be prepared when you go into any of these meetings. You know, you're going to be most likely dealing with a staff person who's going to know these issues better than anyone, including some of our staff at the American College of Cardiology. And so you don't want to first and foremost make up anything if you don't know, but also just be as prepared as you can. You're not expected to be the expert here, but you should at least know where your senator or your representative is on certain issues. The other thing that you noticed was that there was a lot of background noise. I tried to purposely look like I was distracted. You know, these meetings are going to be from either your office or your home, and so you may be tempted to multitask, but especially if you're on video, or even if it's on audio, if you know, there's kids in the background, things like that. People understand this is a trying time in the COVID-19 era, but try to minimize distractions as much as possible. The last thing that I'll say, and then we'll go into a role play where things go better. You remember that you're representing the American College of Cardiology. Don't bring personal issues to your televisits. You may be very passionate about it. You can schedule time, of course, on your own to discuss those things, but it's important to stick to the talking points that we have for this meeting. So with that, Senator, should we try again?
Aaron, can I just add one more brief comment? If you know the committees that are important to the college, and whether or not your contact is involved in that committee can give you an opening that is easier than and a way to start a conversation.
Yeah,
Even
so certainly. Yep.
On board with what you want them on board with, if you understand where their power.
yeah.
Yeah.
And remember, I would like to remind our early career and FIT members that when you go into these meetings, rarely are you going to be asked or put in a position to make the big ask on a bill or anything like this. We will probably point to you and say, you know, can you give us an example of what it's been like in your telehealth, in your training at UVA, something like this, or Aaron, you know, at Mass General, did you find so-and-so? So I think that we will put our younger colleagues in a position of, as Sandy said earlier, of telling a story, of giving an example of that really something that affected you or impacted your relationship with your patients or something like that. And so it's much more likely the senior members on the team who are leading that team are going to be talking about the bills and things like that. But we may ask you to say, how is this important to you in training?
Yeah, I think that's key. So with that, why don't we try this again, Senator, if that would be okay.
As long as my dogs aren't barking too.
Senator, it's nice to see you again. I'm Aaron Kiskart. You'll remember I'm a cardiologist here in New York. Today, I'm proud to be representing the American College of Cardiology along with several of my colleagues here. We represent cardiovascular experts and not only physicians, but we also represent nurse practitioners, PAs, and the entire cardiovascular care team. And I want to thank you for your prior support of the American College of Cardiology.
Well, thank you, young doctor. It's a pleasure to be with you today virtually. I'm glad that you were able to tag in. I see that alongside you, you have several of your team members, some of your trainees. I see a couple of the different medical institutions with you, and I assume you have some team members with you today in your approach.
Yeah, we do. And in the interest of time, what I'll do is I will email you after this meeting and give you our contact information in case there's anything that we can help you with. But there's a few things I just want to highlight, if that's okay. So the first is the importance of cardiac rehab. I spend most of my time in research, but I practice 20% of the time. And over the last 6 months with COVID-19, it's been really difficult for my patients to have access to programs that we know improve health, like cardiac rehab. One of the things that was done in response to COVID-19 was the expansion of telehealth services. And we want to make sure that actually that continues beyond this pandemic. There's a Senate bill I'd like you to note down, 2842. I noticed that you're not a sponsor of that yet, but it's the increasing access to quality rehab care. What that would do is allow better access to New Yorkers who need cardiac rehab, usually after a heart attack or after surgery. And that allows them to have access to cardiac rehab in their homes if necessary, but can be supervised by an NP or a PA, part of our cardiovascular team. And so that means that more New Yorkers would have access to good quality care. Is that something that you could support at this time?
Absolutely. My older brother suffered a heart attack and is here in New York and went through the cardiac rehab services. And I think it was a big benefit to him. And so, yes, I would love for you to get with my Health LA. Do you know Elizabeth?
I do, actually. And when this started, I had sent Elizabeth a recent journal article from the American College of Cardiology about cardiac rehab. So I would love to get in contact with her again if we can get you to sponsor this bill with us.
Superb. Yeah, I will look into that. I'm very interested. I'm with you on this, and I think that the fact that you've spoken to Elizabeth before and know her will make this easier for us to be able to get together, and she'll have the information you sent her and we'll be able to link it with me. And I think that we could work on perhaps co-signing that. And I'll look at the numbers, make sure it goes well with our agenda and what we're trying to do, but I think I could support you there.
Great. Thank you, Senator. The other issue I wanted to bring up was the access to telehealth. Right now, there's not a bill in the Senate, so I don't have a specific ask for you today. But I would like to just make you aware that telehealth services are vital to providing care for patients, even outside of the global pandemic that we're currently experiencing. And what it does is it allows doctors and the entire care team to communicate with patients in their home, making it easier for instance, elderly patients, which tend to have more cardiovascular disease, for them to connect to their providers without having to go into the doctor's office. Like I said, there's not a Senate bill right now for you to sponsor, but what I'd like to do is just put that issue on your radar, and if that is introduced in the Senate, if it's okay, I would just reach out to you by email and let you know that it's arrived.
Excellent. No, I'd be happy to look into that. I realize that in trying to get my mother to the doctor, how much trouble I've had trying to get her, and now she's in a nursing home, and with COVID restrictions, this is absolutely a disaster. She can't get the care she needs. So I hope that you're training your young doctors in this as well, and the trainees, and they're learning telehealth as well.
Yes, we are. It's actually a priority for the college to expand these telehealth services. And part of that includes training our physicians who are in training now or early career to utilize those services. Thank you, Senator.
Yes, sir.
I know we're almost out of time here, so I just want to give you the opportunity. Are there any issues that are important to you or anything that we can tell you more about the American College of Cardiology?
Well, I've been a big supporter of physicians and healthcare, and I hope that you'll support me. I hope your organization will support me. I've got a big election coming up here in a few months. I've been by your side the whole time. I hope I can count on your support from the college as well, both locally and nationally.
Yeah. Well, what I'll do, Senator, is we share our discussion with our ACC staff, and we'll let them know that you appreciate our support. And that's a decision that would be made by our political action committee. But I do thank you for your time today.
Thank you. Thank you for coming in here. And my staff looks forward to working with you more closely.
Great. Hopefully that was a little better. Any comments from anyone in the team? We can pull up the slides now.
I think that was amazing. Amazing. I mean, it was not as funny as the first one, but no, that was an amazing role play presentation. I mean, the respect mutual respect you have for one another, as far as you definitely were both taking the time to make sure you didn't have any distractions on either end. You're very prepared as far as the issues, who you're speaking with, and also the fact that you had already reached out to one of his staff members, Elizabeth, in this scenario, was, I think, particularly useful and helpful. I would want to not dissuade people listening that if they have not already been doing this to be intimidated by it, but that was, I think, a very poignant part of this.
And Brenton, I would really like to emphasize to all of our early career and FIT members out there that if you listen to all this, it's easy to get intimidated and say, wow, I'm not going on that Tuesday visit because they're going to ask me something I don't know about. I want you to trust the senior members on your team. The more fellows we have there, the more impactful, the more early career, the more impactful. You will not be asked to make major presentations in front of a senator. You're there as a part of the team. The elder statesmen, the Sandy Lewises, the Dipti Ichaporias, they'll be making the big ask. They'll just be asking you to chime in as a partner in the healthcare team. So I want you, FITs and early career docs, to be there on Tuesday and be supportive of this. You don't have to know all the facts of the bills, and don't be afraid to join because of that.
Yeah, absolutely, Mike. And I think one of the things I tried to point out is that you can share your personal story. A lot of these bills are very relevant to early career and FITs. And so talk about a patient that you have that might need cardiac rehab or a telehealth visit that you did. And it doesn't have to be a glowing story about a success. It can be a challenge. For instance, you could talk about a telehealth visit that didn't go that well and you want better resources so that those can be improved. But those are great examples of what you can share, even if you don't know anything about these bills. Obviously, we're talking about here the long relationship that you can have with these members of Congress, and that goes a long way. And so getting involved right now is critical because 10 or 20 years from now, those senators might still be in office and those representatives might be in the Senate now. And so having those relationships, it will become more like a catch-up. And so when you go into the office, they'll already recognize your face. So in the few minutes we have left, I just want to go over some best practices and then hopefully have a little bit of time for questions. So you can actually check your schedule now. When I've done this, I had my 2 senators visits already scheduled as well as my House member. I don't know, Lucas, if I'm supposed to tell people that or not, but you can go to this website here at clients.primeadvocacy.com and log in with the email address that you use to register for the legislative conference. It could be a Gmail account, or it could be your work account or an EDU account. Just remember, whatever you're getting those emails to, that's the one you use. There's no password. So check your schedule, make sure that you're available. Even though it might be up now, it can change and likely will change. So Congressional visits are notoriously flexible up until the moment they happen. If there are any last minute changes, we should be reaching out to you, but just keep that in mind. And so the night before, check your schedule just to make sure it's the same. There will be an opportunity for you to meet other people from your state. So Monday night at 8:15, your team leader should organize a meeting, and that's where you'll decide who's going to be the lead for your group, who's going to talk when. Again, because of the likely short nature of these visits, it's going to be hard to introduce everyone. And so more likely you'll be following up electronically. You can read about your member of Congress. You should do that the week before. So you can go to house.gov or senate.gov, read about them, and just look to see if they've supported any of these bills that we're talking about already. And then, as Lucas mentioned, you should receive your talking points next week. And so just make sure you're familiar with those. On the next slide, we have some best practices for during the meeting. I would suggest actually printing out those talking points, or if you have another device, to have a second screen off to the side, because it's really important to be prepared for that meeting. Don't be surprised if you are connected by phone. A lot of times these visits get interrupted, or they may start late. And so your staff person or even the member of Congress might prefer to do it by phone and not sit in front of a computer. You might have as little as 15 minutes. You might have as much as an hour. It really depends on the person you're meeting with. But be prepared to get through your talking points very quickly, because you don't want to be on your first one and the senator ends the call. Again, quickly try to introduce yourself, but save long introductions for follow-up, and try to cover your priority issues first. And you'll decide that the Monday night before your visit, and have those in order, so that if you have the chance to go through all of them, you can. If you don't, then you'll at least get to your priority one. I think one of the most important things happens after the meeting, and so you want to follow up. Poonam's always great. Whenever I'm in a meeting with Poonam, I always know that she's there because she's tweeting about it. And so she's been tweeting during this role play, and you can do the same during your Hill visit. If you are on video, that is a great thing to share. We all know that pictures spread faster on social media than text. And so if you can take a picture of your meeting as it's happening, all of the members of Congress are on Twitter. And so that's a great way to follow up. There is a meeting notes section of your app. We do ask you to fill that out. If you have a request from your member of Congress, like you heard the senator say earlier about support or PAC contributions, things like that, you should absolutely not have to answer that during the meeting. Follow up with Elizabeth Shaw, who can get that to the right person. And if they commit to sponsoring, let us know, because that's something that we need to follow up on. And then you should always thank them in an email. And so during your meeting on Monday, decide who will follow up and draft an email on behalf of the group. All right, with that, I'll leave the last 3 minutes for any questions that we might have.
That's awesome advice, Aaron. And again, excellent role play between yourself and Dr. Valentine. Thank you guys so much for that. Question is going back actually to the first role play, when the senator brought up, acronym like the Congressional Budget Office and the CBO was thrown off. How would you recommend as far as recovering from something if you're a more novice advocate and you're not familiar with a particular acronym or something of that nature?
Yeah, I think it's a good question. So the acronyms go both ways. So I tried also to make sure I didn't use ACC. Some of our acronyms that we're very familiar with, try to spell them out. If you don't know, this is a perfect example of something where you tell them, I'm not sure about that, but I will follow up with you. And if you say that during your meeting, make sure you actually follow up. So if the senator says the CBO assessment of the bill was that it was too expensive, you can say, I don't know the details of that, but I'm happy to follow up, and then just make sure you do that.
That's perfect. And then also, I really like your on the last slide as far as commenting on if you do get put in a position where they ask for the support of you on behalf of the entire ACC, is that you shouldn't be needing to respond to that, and just to basically indicate that to Elizabeth Shaw, or is there anybody else that they should be alerting about things like that?
Yeah, I think probably going through our portal or the app or Elizabeth Shaw would be the most appropriate way, because then Liz can get that to the right person. You might get bizarre questions. They might sometimes, I remember one of my ACC visits, they started talking a lot about opioids, and the ACC and cardiology, we don't really deal with opioids as much. And so it's something that you can flag to staff, and Lucas and his team are following up with these offices. So you could bring it to their attention. But you absolutely shouldn't feel like that you have to respond as a representative of the ACC to their request.
Great advice. I want to thank yourself, Dr. Valentine, for the amazing role play. All of our panelists, Dr. Ichapuria, Dr. Steiner, Lucas, Dr. Chen, Dr. Lewis, on being a part of this. And ultimately, thank you to everybody that was on the webinar, all the audience members, and your future participation next weekend and going into the next week at the virtual legislative conference. And we're excited to be a part of that, and to move forward with advocacy within the college.